Hi, welcome to this webinar from Sonaviv Medical Institute. What you're seeing is a part of our medical team here at Sonaviv, and today we're going to be talking about the integrative approach towards cancer. Sonaviv really is an amazing place that focuses all these different disciplines towards many different health issues. One of them in particular that we're going to be talking about today with you is cancer. So we're very excited to share with you some of the answers to the questions you asked us, and many questions that you asked us about, what you need to know and what you would really like to know about the integrative approach towards cancer. So my name is Jonas. I'm part of the psychology department here at Sonaviv. I'll be speaking to some of the more psychological aspects of what we do here in this integrative approach. And I would love for all of you to just kind of chime in and just tell us your names and your position here. So just go this way like that.
Hi, my name is Armonia Rodriguez. I'm part of the medical team here at Sonaviv. I will be presenting the medical questions that you had submitted.
Hello, my name is Claudia Shafina Leiva. I'm part of the dental department, and I'm going to share with you also the all that I know about the dental aspect in relationship with cancer.
Dr. Lanza Gorta, in charge of the energy department here at Sonaviv, and we'll talk about all those aspects of energy and how to integrate energy into the whole program here at Sonaviv.
Hi, my name is Oscar Puig Donelli. I'm part of the nutrition team here at Sonaviv, and I'll be speaking directly to you guys about what are the best aspects of nutrition to help you reduce cancer threats and help to improve overall health.
Hi, and I'm Dr. Fernando Labrada with the chiropractic department, and we're going to be talking about what role chiropractic can have in helping reduce the stressors that can lead to an impaired immune system, which will generally end up affecting the way our body responds, and how that can lead to other degenerative diseases as well as cancer.
Okay, so I'll be leading this for a bit. This is we do this a lot, particularly in this room. We talk about every guest that comes here. We have these meetings. We have these very rich discussions. Usually, we don't have this online or in front of a camera with a lot of people hearing us. So this is a little new for us. So bear with us if we're a little nervous or just stammer a little bit. So we have all these questions from you. Some of them, of course, didn't really make the cut because they were very specific to one particular health issue and going to certain areas that we wouldn't feel comfortable talking about because we don't really know the person. We don't really know what's going on with them. And to give a specific answer, take this, do this, this treatment will be the best for you, that we can't do that. There's tons of ethical concerns there. So those questions we really avoided because we wouldn't be able to give you very useful information. If you or anyone you know really needs to know more about more specific things, like direct things, A, B, C, it'd be very important you call us and just contact us to get a direct consultation with one of the doctors, probably Dr. Armonia here. She does a lot of that, and you'll get all those answers that you're looking for answered a lot more clearly than what we can do today. Because today is really about that integrative approach, this team that you're looking at here, and how we all work together to create healing, or more healing in health for our guests. So I'm just going to jump into some of these questions. This is a question for both the medical department and the nutritional department that says, a friend of this person was advising a friend that they needed to take some USANA nutritionals, supplements, because they were dealing with cancer. But a doctor said that vitamins are not good in her situation because they are feeding cancer cells as well as the healthy cells. And she asked, well, what can I tell her about that? Is this true or not? So who would like to take the lead on that one? It's a question for both of you.
Well, I think we both have our ways of thinking and explaining, and I do want to include Oscar here in this answer. In general, since this question is kind of specific, so it says in her case, the doctor said don't take supplements in your case. So I'll speak in general terms, not in this specific case, like is USANA a supplement that we would recommend some people take when they come here? Yes, we have recommended those. That if we believe those will specifically beat the cancer, I don't particularly feel and think that would happen. And also the nutritional aspect of how certain nutrients can feed the cancer cell. Well, cancer cell is a different type of cell. It doesn't behave as a healthy cell does, so it has different receptors. So we do know that they respond more to a high glycemic index in the diet, so that's why I want Oscar to touch this topic and to answer that specific question. But I don't believe that USANA supplements would feed the cancer, no.
A little bit on that. I've never really read any medical study or any clinical study by itself that says supplementation in this case would feed the cancer cell. I've actually read positive studies about patients that have gone through chemotherapy and actually had reduced symptoms of the chemotherapy with supplementation. I agree, Dr. Armonilla, there is some supplements that can feed cancer cell. There are specific supplements, in this case, L-glutamine can be one. In this case, it's been widely studied about it. But as a general antioxidant supplementation, specifically with patients going through chemotherapy, I've really never found anything that would feed the cancer cell other than actually benefit the patient from, in this case, the symptoms that chemotherapy may produce.
There's also a lot of studies like that with people who benefit, like with curcumin, turmeric,
resveratrol, vitamin D, vitamin K.
The important thing is to get this conversation going with your doctor. Come down here for an evaluation so we know exactly what would be more appropriate for that person.
And if I can say something, sometimes it looks to me that there is misinformation from the time of from the medical doctor, because sometimes we misunderstand nutrition, nutrition supplement with medication of some sort. And it's almost like telling the person, because you have this disease, I don't want you to eat anymore. Because by the process of eating, we are getting nutrients. And sometimes they are so depleted that that's why it's recommended some extra nutrients. But it's not a process of saying these nutrients, you don't take them, but you need to continue eating, and many times eating trashy foods that really doesn't make the sense here.
And it will go down to basic nutrition information. The majority of cases that we've handled here, the biggest mistake, I will call it a mistake, is that the doctor or the doctor's team have not sit down with the patient to tell them how they should eat or what's appropriate for their nourishment. Typically, they just are concerned with caloric intake, which is also a big mistake, and Oscar will talk more about that. But the nutritional aspect, it's very important.
Well, again, there's no real guidelines about what to eat. We have many stories of patients coming in with chemotherapy, radiotherapy, and asking them, have they indicated a diet for you? Well, in reality, not. The answer is just eat whatever you can and keep whatever you can keep down. Not really actually assessing the quality of food, the quantity, the breakdown of macronutrients, or in this case, the nutrients that the patient requires. Like we know, any chronic condition is really widely associated with chronic deficiency of a nutrient, in this case.
For chronic inflammation.
Or chronic inflammation process, right? So really no guidelines to indicate a specific requirement of a diet to a patient if you go through a normal type of therapy, in this case.
Yeah. And just kind of piggybacking on this one question and just jumping into something for you, Oscar, in the nutrition department. A question that came up, and I think there's a lot of controversy around this, is that, what are some of the foods that are most likely to feed the cancer? Of course, that can be very specific in terms, but in general terms, what could we say around that?
When it comes to cancer, we all know that sugar is one of the main things. We've known this since the 1800s with Otto Warburg doing the research and actually winning the Nobel Prize about sugar being the prime component to actually have more growth to the cancer cell. So off the bat, the first thing would be basically no added sugar to your diet, no added sugar at all. And you always have that idea of low glycemic, high glycemic, medium glycemic. No, I would say really change it to a very low glycemic, because once you change it to a very low glycemic, you really have an abundance of antioxidants coming into your diet. Most of the low glycemic foods are all vegetables. You do have some root vegetables that provide a lot of carotenoids in this case that will be found in medium glycemic. But in reality, try to keep at least 90% of your total carbohydrate intake of low glycemic carbohydrates. Now, what other foods? Like I said, processed foods should be out because added chemicals, added preservatives, added flavorings, in this case, or colorings that are also, in this case, linked to cancer. Artificial sweeteners also linked to cancer. Genetically modified organisms. There's always this big doubt about GMOs being a culprit to cancer now, and there's always this in the scientific community about if it is correlated to cancer or not. By my standards, anything that's manipulated by the human being we should really stay away from it because it's not really coming from nature. Apart from that, I would say hydrogenated oils also, and that I think that would actually have more of a complete area now.
Just kind of in general.
In general,
Yeah. That's great.
Okay.
Dr. Mania, would you be able to tell us a little bit more about what's the difference between the cancer cell and the regular cell, and how it metabolizes sugar differently, or why one prefers the other?
How so? Can you?
Yeah, it's like cancer cells prefer sugar.
Well, all cells need sugar.
Correct.
The glucose, we all need glucose to thrive. Our brain cells thrive on it. That's the major source of fuel. It's just that, let's just imagine more so to have a very easy analogy, just like a bully in the classroom. It will pretty much beat everybody out to get more of the nourishment, or more of the substance, more of the milk money per se. It has been told that it might have more receptors for glucose than the other normal cell. So it will just be more grabby of that very important substance. So if our diet consists of majority that, you're overfeeding that bully. Just imagine that big bully.
Making them stronger.
Making them stronger, sorts, yeah.
So in Oscar's, in the nutrition-wise, what you're doing is you want to basically starve the bully and make him the skinny guy. So
Make
he's
him
not
the
the
skinny guy, mellow
bully
guy,
anymore.
and not be able to grow and hopefully die. But we know with cancer, it does require, it's such a difficult and easy question at the same time, because cancer is a very multifactorial condition. And we have to treat it from many standpoints. That's why I like the integrative approach, because every part of that individual has to be analyzed and treated, not just focus on the cancer cell per se.
Okay, so let's switch it up a little bit. This is a question for dental, and this is something that I think we hear a lot. Some information might be great about this, some not so much. But with Dr. Shafino being an expert on this, the question would be: would removing the mercury from my dental fillings help fight cancer? What's our take on that, Dr. Shafino?
Well, yes, the mercury is one of the most important toxins that we need to remove from our mouth, because that can generate a disturbance field into the mouth in relationship with the saliva and the metals. They can generate a reaction that could be a galvanism. and that can affect different organs or system into the body. So, and specifically for cancer, mercury, it's very important to be removed, but also on a safety way, because sometimes when we have the mercury in our mouth, if we are not having a good detoxification process, then it's not a good idea to remove them. But we need to work, as Dr. Armonía says, on an integrative approach, bringing a good health into each person, and then decide to remove those mercury fillings. The answer to that is yes, it can contribute to get better on the cancer. We cannot promise that after removing mercury fillings, cancer will be released or cancer can be cured, but that can release a lot of stress from the body, reducing all those toxins from the mouth. But also other areas that can contribute on releasing the toxins into the mouth will be remove any type of root canals, remove any type of bioenergetic disturbance like cavitations as well, any metals from the mouth, and of course the bacteria coming from the gums. That also can be a good triggering on developing that the cells are not fighting correctly for the cancer. No? So we need to remove all type of bacteria, all type of toxins, all type of metals, mercury out of the mouth to help to release and to help to the body to improve on its overall health.
That's really great to know, because yes, as we were saying before, there's a lot of controversy around this. A lot of people say that it's not an issue, that's something that's been practiced safely for years by dentists, but we have a different opinion. Yeah, absolutely. Okay, so one question for Dr. Lanzagorta as the head of the Energy Medicine Department. We do a lot of type of testing at Sanoviv, a lot of different tests ranging from different fields. So the question is, how does the energy medical evaluation fit in with the overall tests that we do here at Sanoviv? How does all of that come together?
From the point of view of energy, I normally tell the patients that come to the office, I said, you will find out when you come to Sanoviv that indeed life is extremely busy here. You are going to go from test all day long. Perhaps even more stressful at some points than being at home. But the reason why we are creating all those tests is because for us, every test is a piece of a puzzle. Some pieces, we can know exactly where it's going to fit right away. Some other pieces, it really takes mental work to find where they belong. But when we come together during the days to talk about each case, every one of the health practitioners bring their pieces, and then we can see how the image of that puzzle starts to form, of where the body is, possible reasons why it's there, the path that is following, and possible dangers ahead, so that the medical team can provide you with a very specific and grounded detour, so you don't have to go that way, more likely because that's the reason you came here. So for us, when we do this type of energy test, it's something a little bit different from your biochemistry that you get in almost any lab, or body parts that you get through x-rays, ultrasounds, and things like that. This type of test will tell us about energy, the flow of energy. But energy in the body carries information from the center computer, the brain, to all the organs and glands. Remember that our body is nothing but the most beautiful orchestra that you can imagine. And somebody needs to be directing the show to control 100 trillion cells, all in harmony. But these organs and glands also respond back to the brain on a feedback loop. And so that flow of energy and information is the one that we check when you come here to Sanoviv. Because energy is very important. Just imagine that two legs for healing. One, we can say, is the flow of life. And that flow, if it is freely moving, obviously it will send all the information back and forth. But if you have, as you have been told, problems with the teeth, problems with the spine, scar tissues, broken bones from the past, toxins, malnutrition, then that energy can be slowed down, can be blocked, can be totally stopped in some areas. And on the other leg, you have all the biochemistry that you can dream of. So imagine that you have a good flow of energy, but you have a cell here, we are going to call it a printer, that you forgot to put the correct paper and ink on this printer. And if you try to tell the printer, print 500 copies, full color, double-sided, the printer a million times is going to tell you, give me the paper and ink. And that will be the end of the story. So it is the job here of the health practitioners, like the doctor, like the nutritionist, to have the correct diet, the nutrients, perhaps some holistic medications, allopathic medications, that will provide the cells with all the micronutrients, all the paper and ink for that printer. But on the other hand, if you have a cell filled with paper and ink, a printer, but not connected to energy, in medicine that is called a cadaver. It just doesn't work. You need both of them. One part that is sending the information. So what we are checking there is how well this information is arriving to the printer. Because if you cannot find that information correctly, the whole body is going to come into disarray. It's almost like in an orchestra that the director says, let's play Mozart, and all of a sudden says, no, I love Elvis and I would like to play Elvis, and somebody else wants jazz, and all these frequencies come together to create a mess. So our purpose here is to find out what about the blockages that you may have on that coordination of 100 trillion cells, and how to start opening that flow so that everything starts moving the way it should move. And that is the place basically for energy medicine here at the hospital.
Okay. So, coming back to an interesting question for nutrition and medical department. This person says, I just learned today that if a person has tongue lesions, this could indicate autoimmune diseases and possibly cancer in the body. What's your take on that?
I would pass this to Oscar. No, he actually, yes, the tongue can tell us a lot about a person's illness or how the state of health of that individual, just as nails, such as skin, such as a lot of things and tools that we use. But Oscar is the person that pretty much has that corner mastered here at the hospital.
The tongue expert.
That's a good question.
It's part of your nutritional assessment.
Yeah, I've actually never really seen a tongue lesion in all our patients. What I've seen is different type of colors, different type of size of tongues, spots in the tongue, cracks, in this case, that may be related to deficiencies, dehydration primarily, hormonal irregularity. But lesions, I'd say anything that is a lesion in the body may promote a lot of inflammation. And since it's a gateway or an entrance to your body, that inflammation, like example, dental cavities or infections, it may promote more inflammation inside of your system. So it can be related to inflammation. What type of inflammation? I don't really know.
The lesion, saying lesion is a very broad term to what we can find in any place in the body. So the tongue, as Oscar's explained, there's even in the medical books very well described chart and tongue pictures that you can see that guides to deficiencies, to autoimmune diseases. So it's kind of difficult to answer that question in that regard, that one is linked to another. It's something that we have to see by ourselves and tell you, oh yes, this can be an autoimmune issue, or this is a deficiency issue, or sometimes more simple things like a sore, something that the dental department can analyze it better. So That lesions in our tongue can tell us something, yes, but it has to be more visual for us to actually say.
Yeah, and to be
Mhm.
specific to cancer, but
Yeah.
we would need to actually
Yeah,
just have it.
Unless you have a lesion that's suspicious of tongue cancer, then that's a whole different story. You have to see that and treat it fast.
I think that's really one of the strengths here at Son of Eve, this team, that wherever something different might be coming from in the tongue, we have the expertise, we have the people here to correctly, assess, diagnose, and probably treat whatever that might be going on. So
And to see it in our perspective,
Yep.
because I can see it as one form. It might mean something to me, it might mean something to her, it might be something different, the structural, and then we come together and we say, well, in my area, nutrition, this means this, in dentistry, it means this, and so that's exactly what you're saying.
exactly. The beauty of what we do. Okay, here's an interesting one. I like this one a lot because I think a lot of times we have that impression that just because something is natural, it can't hurt a person, so they can do as much as they want or as much as they need. And of course, that's not the case. That's not something that we know to be true. But the question is, and this is for both of you as well, can high doses of IV vitamin C, over 30 grams, cause hardening of the arteries or capillaries?
Okay.
That's a good question.
Yeah, like here I would say, you have to, when one is doing anything intravenous, or with any treatment, you really have to do your research of what the doctor is recommending to you. So there has to be some responsibilities in the area of the doctor and the area of the patient. The patient has to be well informed, either the information provided by the physician or by their own research. And nowadays, with the easiness of the internet, most patients have done their own research. Why am I talking about research and the quality? Because you really have to see what type of vitamin C where they're getting it from, if they're compounding them themselves, or it's a well-reputable place, what type of things are they putting inside of your vein? Because if you have had an experience, if you're asking me this, it's mostly because you've probably heard it somewhere that this person got vitamin C, got hardening of the arteries. I can tell you clearly that does not happen. What can happen with continuous puncturing of an artery with any substance, it can create some localized inflammation, maybe hardening of the area, because it can create a scar. But typically hardening of the arteries because a person has been injecting stuff, usually are substances that are illicit. There are illegal drug use, heroin does that. It does create hardening and scarring of the arteries. Some patients can do that with certain chemotherapy drugs, can do that. Amphotericin can do that. That's another medication. But vitamin C, in my experience of 10 years, and then the combined experience of we have not had a case blamed on hardening of the arteries because of vitamin C. But do look at certifications from the doctor, what substance that the product is a good pharmaceutical quality vitamin C from reputable sources, so that you are more confident that this will not happen to you. But in theory, it should not happen.
Anything on that, Oscar, that you would like to add?
No, not really.
Well, the experience.
All right. Yeah. So here's, and I'm not really sure. I found this interesting because we might have a clear answer for this. So sometimes, these are some of the things that we can specialize in, that we can see differently and think outside of the box. Here's one that came in. I work with cancer survivors who have lymphedema from surgery and the taking of lymph nodes. What can they do to minimize their swelling and discomfort? They are doing traditional treatments for pressure garments and wrapping. So is there anything that we know from a more integrative approach, taking in all that we do here, that could help for this situation?
Well, there's things that we might consider. There's a lot of structural component that maybe Dr. Lorella can also help us there. But by removing the lymphatic tissue, you are somewhat enabling that part to drain. So there's going to be inflammation, there's going to be fluid there. Compression is typically the recommendation, also exercise. Lymphatic massage, that I have a lot of patients that have never been offered or gotten into some physical therapy treatments that would offer that to help them. It can help, but you have to be consistent to it. You can't do one a month and hope that it will relieve the anatomy. Also, we have to, when we're doing an integrative approach, we're also seeing what other areas we can help that person in their body and their uniqueness to see if there's any other sources of inflammation that might still be adding to the fire, so to say. But I think here maybe structurally Dr. Lara can tell us what else, if there's more mechanical things, but typically they do well with
One of the things that we want to look at is how much of the structure has been interrupted and where those interferences are located. That's where energy medicine can help to help identify that, as well as the bioenergetic medicine. Identifying if the interference is how deep it goes in or whether it's just superficial. Some of those pathways can be restructured and can be re-neural organized for them to start functioning again, but it's going to be a slow process, as you mentioned. It's going to take time, and it requires consistency. You can't expect, as you mentioned, to go once a month and have it done. It's not going to work. It's like with anything else, the body gets used to patterns, and those patterns have to be reestablished, but it's going to be a slow process. That's one of the main things. It's going to take time, and it requires consistency. What body part is being you can't expect, as you mentioned, the lower extremity once a month and have it done. It's not going to work. It's like with anything else, the body gets used to patterns, and those patterns have to be reestablished, but it's going to be really just as I mentioned, it's going to take several factors. And it requires good things that we do here, is that we can't expect each of those areas mentioned, the lower extremity once a month and have it done. And what can be done to go. It's like with anything else, the body gets certain patterns, and those patterns have to be reestablished, but it's going to be really just as I mentioned, it's going to take several factors. And it requires good things that we do here, is that we can't expect each of those areas mentioned, the lower extremity once a month and what can be done to it. It's like with anything else, the body gets certain patterns, and those patterns have to be reestablished, but it's going to be really just as I mentioned, it's going to take several factors. And it requires good things that we do here, is that we can't expect each of those areas mentioned, the lower extremity once a month and what can be done to it. It's like with anything else, the body gets certain patterns, and those patterns have to be reestablished, but it's going to be really just as I mentioned. And it requires good things that we do here, is that we can't expect each of those areas mentioned, the lower extremity once a month and what can be done to it. It's like with anything else, the body gets certain patterns, and those patterns have to be reestablished, but it's going to be really just as I mentioned. And it requires good things that we do here, is that we can't expect each of those areas mentioned, the lower extremity once a month and what can be done to it. It's like with anything else, the body gets certain patterns, and those patterns have to be reestablished, but it's going to be really just as I mentioned. And it requires good things that we do here, is that we can't expect each of those areas mentioned, the lower extremity once a month and what can be done to it. It's like with anything else, the body gets certain patterns, and those patterns have to be reestablished, but it's going to be really just as I mentioned. And it requires good things that we do here.
In the venous system. So, for example, this morning I had a chance to teach them some of the exercises, and they can do them when they are laying down flat on their tummy or on their back, standing, sitting on airplanes, watching TV. The important issue is, remember, I need to keep the pump pumping and not let it just rest, because the arterial system truly is moved by the heart. But what about the venous, the lymphatic system, and the liquids, extracellular fluids? They are not being pumped by the heart. They are being pumped by muscular contractions. And so that will be a key aspect for them to learn.
So, I'll take this one. There's one for psychology, and it says, do we recommend any meditation CDs that are great for healing? Well, you well know there's tons of them. Just Google or go on Amazon, you'll find the most popular ones. I would love to feature some of the people we work a little closer to, people we know, and that we really enjoy their work, and share it with our guests here. So one of the resources is from a website called AuthenticityAssociates.com. This is by Dr. Ward and Dr. Stokes. They were actually the founders of the psychology department here at San Aviv. They have some just really, really amazing meditation CDs that can really help bring that healing process along by stimulating these healing responses through relaxation. So that's AuthenticityAssociates.com. Another one is also a good friend of ours that she and her husband have worked with us in the past. She has some amazing, amazing meditation CDs. Her name is Laurie Morse. She's an acupuncturist. And her website is lauriemorse.com. So you'll find some amazing things in these two websites. If you're looking for something that, you know, is, well, not just the kind of the big people out there that millions and millions of people know that you can just get anywhere, and want something a little bit more specific to what we do here and what we practice here at San Aviv, these are two great resources. Their work is amazing, so you can support them and just get some really great products. So that would be a question I had. Here's another one for nutrition. Would losing body fat help fight cancer?
And well, not only cancer, it would help you to rebalance your whole system. You know, as we know, fat by itself is just not fat. You know, it's not just a secondary source of energy for the body. It is actually an endocrine organ, so it produces a lot of chemicals in the body, like insulin growth factor, tumor necrosis alpha, ApoB. You know, it produces also steroid molecules, hormones like estrogen predominantly in the body. It produces leptin that can dictate also appetite in the person. It can dictate also cravings in the person. It produces resistance also, in this case. It produces other molecules that can actually promote inflammation in the body. Naturally, if something is out of balance, for example, like having too much vitamin C even in the body, having too much carbohydrates, having even too much protein, and anything that's going to be in increased amount in the body will create an imbalance, and then will create a situation in the body. Fat by itself, also we know, it adapts to almost anything. It actually preserves chemical compounds in the body. Preserves heavy metal toxins, preserves other things, now in this case like medication also. So naturally, if you lose fat percentage in your body, I wouldn't say that you lose to a percentage that you're, let's say, in the 10 to the 20s, now in this case, for both sexes. Now fat is actually required to a certain percentage, for males and females. It's actually required to maintain heat to the organs, stability to the organs. It's actually required also as a reserve energy, so we really need to have a certain percentage. But again, I'll repeat myself, I hate myself to do this, but really anything out of balance should be really imbalanced in the body. So too much fat percentage, which is always going to be out of balance in the body, will create an imbalance, an inflammation in the body, a toxicity in the body, and for any condition, will promote exacerbation of the condition. So naturally, the response to this is yes. Losing fat will help any condition.
Yeah.
Okay.
Okay. Perfect. Yeah, and thank you for that, because one of the things that are really important for you to know about San Aviv, if you've never been here before, is that a lot of these questions you're asking, a lot of these things that you just see, for us to answer specifically to your case, it takes a lot of hard work. We go deep into all these different areas, so we're really giving you a clear, truthful, and consistent answer. Because a lot of times, people can throw out certain answers, yes, no. We mostly just say, maybe, let's find out. Let's really find out, because this is why this team is really so diverse. This is why we have so many people working here. We love to find out the truth. We love to find the core of the issues. And we have that ability because of the depth of this team. So we have one final question, and this is one of those more general questions, but I wanted to put it in there and see if there was anything really that we could share in very broad general terms. And the question is, in general, Are there any supplements that are good overall for cancer, for treatment of cancer?
So many.
So many.
So many.
Yeah.
You would like to
There
say
is
first?
so many. Geez, it's not an easy question. First, I would say curcumin would be most beneficial if we have to choose one, because we can go into many. Because what we tend to do is look at the status of that person to see if there's any nutritional deficiencies and then their metabolism. So it's not as easy. I would, let's say for a person who has never taken any supplements or vitamins in their life and they just got diagnosed with cancer and they come, let's say they met me at a casual meeting and say, what's good for me? I would just put good antioxidants but you also want to boost the immune system, and I don't know, it's not easy. So I would focus on the immune system. I would say anything that will help promote your immune system be better. So there is the basics: vitamin C, probiotics, natural anti-inflammatories, flavonoids. There are plenty. I'm also concerned about the stress levels that person might be under, because that influence sleep cycles, inflammation, your immune system. So I would focus on those first to do any maybe bioflavonoids or antioxidants and immune boosting supplements, but there are many.
Oscar?
I think example for cancer, we really want to focus on ones that are going to promote apoptosis, in this case. They're going to promote what is the stopping of the metastasis of the cancer, reduction
Cancer
of
killer cells.
natural killer cells, reduction of inflammation, resveratrol, quercetin, curcumin, it's actually really good to reduce inflammation. Even metformin, medication is actually very widely used. Aspirin also very good to reduce inflammation. Not obviously in a chronic situation in this case. Nutrient-wise, vitamins D, D3, K. If we talk about, in this case, vitamin A, we go to beta carotene. Then we go to lutein. Then we go to lycopene. In this case, we can use also berberine. Also, that's actually very widely used to promote apoptosis. In this case. We can use magnesium, again, we will go to magnesium glycinate, I think would be the best. Coenzyme Q10, EPA, DHA, which makes omega-3. Then you go to GLA, all those GLA also promotes, in this case, production of growth in cancer cells. What else?
The important thing to...
Fiber. Fiber.
But the thing is to also choose a good supplement. A lot of the controversies and why they're bashed so much in the medical community, the use of supplements, it's usually because of the quality. Typically the majority of supplements that are available are over the counter, usually in major stores or pharmacies. We need to look into a pharmaceutical grade type supplement, and more so you're facing a cancer diagnosis. You wouldn't put anything that you would buy at a big major store, to not name any names. But I would be careful to what you put in. It's a very general recommendation. You don't have to have cancer to get these good quality supplements or good quality food. It's either very well said in many areas. Either you pay
you get what you pay for.
you get what you pay for, and you get either you pay your nutrition, your food now and your health now, or you pay doctor bills and hospital bills later. So look for a good quality, GMP certified nutritional supplement. Usually the dosages that we recommend are higher than the typical multi, so be careful of that as well. And always consult somebody if you're not going to come here to get a very good integrative evaluation. Get in touch with a good nutritionist, dietitian, or get as much as of an integrative team that you can. I wish we would talk a little bit more about the psychological aspect, because there's plenty of studies that show that even how emotional health can make sure that the cancer does help improve. I don't know if we have enough time for it, but I think I believe as any of our areas are very important, as also dentistry, but the impact emotional health that a person has during a cancer diagnosis or any chronic illness creates a big impact on a person's health. So I think I don't really want to tell about 2 minutes or 1 minute of it.
Oh, that's me, right?
Yeah.
Right. No, this is important, really, definitely. From the moment that someone is diagnosed, well, no, I should say before that, everything leading up to that person developing these health issues, stress, lifestyle, all these things play a very, very important role in just how people are going to be healthy or not healthy. Then, of course, when a person is diagnosed with cancer, it's very important how quickly they can bounce back in a very authentic way, not just pretend that they're okay in dealing with things. So they're really more focused on their healing than the actual sense of them being sick. So a lot of what we do here at Sonavive is help them in that process, give them the right tools to create more of that healing response in the body, which is very linked to relaxation. So basically, the more relaxed a person is, the more positive their outlook is, the more they're in that natural healing state. Which is not to say they can't express negative emotions. A lot of times that's what people equate. I need to be all positive, all good, over here. No, that's not realistic. People need to really express all those emotions, connect with them, but just not dwell on them. So we do a lot of work here at Sonavive. Actually, several departments focus on this, not only the psychology department, because we have, again, so many tools, so many ways of approaching that emotional aspect that we all chip in that process.
Yeah. Okay.
There is something related to that I believe Dr. Labrada should get involved with, especially regarding structure in the body and the effects of the structure, because that relates a lot with emotions, with energy, with everything like that.
One of the things we are familiar with is that most any disease process is an imbalance. And one of the things that is common among all disease processes is stress levels. And the stresses, the umbrella that fall under stresses, you can categorize them either as emotional, mental, you can categorize them as chemical, or as physical stresses. And so one of the things we want to do is we want to eliminate as much of the stress as possible, where we're talking about whether it's a chemical imbalance through improper diet, whether it's a chemical imbalance caused by toxins that are either external or external implanted in the body, or toxins that we're exposed to in everyday life. We were talking earlier, just before we started, about the toxicity levels in atmospheric conditions associated with different countries. But those are just small parts of it. There are things, the toxins aren't only external areas or external things that we're become exposed to, but they can be emotional things, which is what we were talking about on us a little earlier, and what Dr. Lanzagorta was alluding to, that those emotions, as we're growing up and we may not realize it, can also lead to a stress level that we're not aware of, which is why having someone to be able to talk to about helps. And sometimes, a lot of times, individuals aren't aware of what's going on. And the energy levels, the way the body interacts with itself, and the energy that it puts out is very noticeable to those that are used to looking for it. And that's one of the things that we work with quite well. In the structural department, what we want to do is we want to reduce any structural stresses that are being caused, because wherever there's a stress, it's going to use up energy. And that energy needs to be refocused in helping to heal the body. And if we can reduce those, in this case, physical stress, then the body is able to utilize that energy in a more efficient manner. If it happens to be nutritional stress, same thing. We want to put, as they say, the body at ease.
At ease, yeah.
Okay, because we look at we don't look at a disease process. We look at a process that's not at ease or dis-ease. Okay? And that's what the general purpose, or I look at as what we're here to do, is to help that process get back to balance. And each of us, plus many more, work towards that end.
Absolutely, absolutely.
What you actually said, having balance, decreasing the stress of the body in all forms, just finding a balance where the body can actually repair itself by itself without the usage of any medication. In this case, we can use supplements and food to help it, and then psychological therapy, structural therapy, and energetic therapy, nutritional, medical therapy, and also dental therapy that can actually take the body to actually gain that access, that balance that we're trying to find.
Absolutely. All right. Perfect. So, in closing, you can probably see from our interactions and the way we're talking, there are no easy answers, there are no easy questions. This is really the importance of a place like Integrative, and I don't say that because I work here, and I'll continue to work here as long as I can, because of the important work that we do. It's the way we approach things, the way we do things, is very, very different. We work as a team, as you can probably see here. We're pretty relaxed with each other, no big egos here, fighting or anything like that. And that, I think one of the things that our guests comment a lot when they get here, and when they stay here, and when they leave, that they really remember the care and the love from our staff. And I think that just really shows from a lot of the things that we do, because we're so happy to integrate this amazing team and serve people in the best way that we can. So thank you so much for joining us tonight. Please remember that you'll be receiving soon some information on our upcoming webinars. So it's been a pleasure sharing this information with you. Hope you're all well, and take care. Hopefully we'll see you here soon. Yeah, happy holidays. Exactly. Happy holidays. Okay, folks, take care. Have a great
Take care.
night.
Bye-bye.
Bye-bye.
Thank you.
Good night.
Good night. God bless.